Hello, and thank you all for joining us today on Spotlight for the Candidate. Today we're speaking with Dr. Tiffanie Tate, a candidate for California Senate District 32. Hello, Tiffany, and how are you today? How are you doing today?
I am thankful for being here, and it is a pleasure to be with all of you.
It's a pleasure for us to have this opportunity to speak with you and today, and I really appreciate you taking the time out of your busy schedule to meet with us for this call. So thank you. You are running for the California Senate District 32. This is a recent change. You upgraded your game. You've stepped it up a notch, and running for Senate um, is a big step forward. So first off, I want to congratulate you on that. And um, one of the things, as you know, Tiffany, one of the things we look for in candidates is, of course, because we are the oath of office, we're looking for candidates who adhere to the politician's creed, And you've been through that entire process with the organization. I know that a few months ago, and you passed the process, and you were certified under the politician's creed. And for those of you watching today who don't know about the seven articles, there are seven fundamental articles that are values based, not policy based, values based with regards to the candidate's relationship to the constituents. And Dr. Tiffany Tate embodies those articles. One of the things we like to do in this interview, Tiffany, is ask the candidate, such as yourself, what can you name two articles that mean the most to you? And you had said that Article 5, protecting the vulnerable, was one of those. Tell us about that.
Well, growing up, I have always been taught by my mom, which is my maternal aunt who raised me. It has always been instilled with me to stand up for those who were vulnerable because I was part of that vulnerable population. Both of my biological parents struggled with drug addiction and they were unable to raise me due to those issues. And my father was homeless due to his issues. And I felt that it's always an important need to stand up for that vulnerable population, not just because my father was part of that vulnerable population, but a lot of people who are in that population are not just addicted to drugs, but they suffer from mental illness. And I was always taught that you must help those who cannot help themselves. And being raised that way, growing up in an inner city, I feel that you have to support those who cannot support themselves.
Admirable, absolutely. Homelessness. I mean, that is a big problem in this country, and they are so vulnerable on so many different areas. Yeah. So yeah, totally appreciate that and understand that. Um, if if you make it into office, and we definitely hope you do, what are some things you can do about that?
It's interesting because in the legislature, as well as in California, as well as in my district, a
Mhm.
lot of people want to do things for the unhoused, is for the homeless. And our hearts are in the right places. It's just that we are not aligned. So what I would like to do is try to help get us all on one accord. That way we can actually be aligned and be more productive because right now you have everybody doing their own thing. So if we can actually have a coalition and a meeting of the minds, we can actually be more productive because right now you have this cluster doing something, that cluster doing something, that cluster doing something. And yeah, we're all doing a little something. But if we can actually pool our resources and actually come together, we can do more and we can actually help more people. And so in the state legislature, I would like to actually see us come together because if we come together, we can do more and be more effective and help more people and be more productive. So that is what I would like to see happen.
Okay, fantastic. And as you bring people together, a coalition around this subject of homelessness and solving this problem for that very vulnerable part of the population, I don't know if you've taken a look at what Finland is doing. Finland has done an analysis of the total social costs of homelessness, what it costs in terms of policing them, what it costs in terms of, um, yeah, getting them fed, all these types of things. And they found out that those costs are higher than if the government actually provided housing for them. And so they started a program, I think it was last year or the year before, where the government actually provides homes to all the homeless, all of them. And the results are in now that the costs of that is something like 20 or 30 or 40% less than when you don't do that. So,
I believe that
yeah.
because if you provide the housing, then you can get them working. You provide the mental health support, and you can provide the addiction support if needed. Because people are unhoused for different reasons, but if
Mhm.
you give them the resources, then you can address whatever reasons they need.
Yeah. So yeah, if you get a chance, take a look at that because they have a study on it, and that may be a good resource when you get in office. Don't know, but I'll do the same. I'm gonna look into that a little more. And
Oh,
so
absolutely.
thank you for choosing that one. The other article that you resonated with a lot was number 6, engagement with your constituents, informing your constituents on what's going on and mentoring them. Um, Tell us a little bit about why that's so important to you.
Well, in the 20 years as a practicing OBGYN, when patients came in to see me, I never asked them what their political party was. I asked them what their problem was. And I think it's more important to listen twice as much as we speak. That's why we have two ears and one mouth. We have to be able to
I like
communicate.
that. Yeah.
Absolutely.
Mhm.
We have to be able to communicate. And I think that's one of our biggest problems now. We don't listen to one another and we don't talk to one another. And I think as a representative, I want to make sure I go into the communities and I listen to my constituents and I actually represent them. I am coming out of retirement to do this because I believe when you see a need, you feel a need, and you help people. And as a veteran officer of the United States Navy and as an OBGYN, I have this altruistic need to help people. And I'm part of the Riverside Rotary Club. I'm part of, on the board of Seroptimus International. These are all altruistic organizations, Alpha Kappa Alpha Sorority Incorporated. I've been a member for over 30 years. And these are all community-based organizations where we go into the community, we support the needs of the community, and we uplift the community. I also teach the family practice residents at Temecula Valley Hospital, and I think it's important, and I do it on a voluntary basis. I don't want money for my knowledge. I think that you have to be able to help and uplift people, and I mentor people, and I don't want anything in return. I don't need all the money in the world. I want to live comfortably, and I do live comfortably. I'm able to provide for my children. And I think it's important for us to help mentor the next generation. I support other organizations. I go into elementary school kids and teach them anatomy and just other science issues because even if they want to become enter a trade field, they need a solid basis of science. Because if they want to become a plumber or an engineer or anything in those trade fields, they need to understand those things. Because the elementary school kids, they're going to be taking care of you and me when we retire. So we really have to cultivate the next generation and stimulate those minds to make sure that they are ready for the future. And I don't think it's a matter of political party. It's not a partisan issue. It's a supporting the next generation issue. And I think that's where we have to get back to supporting our youth, supporting the next generation, and communicating and going into the community, volunteering. And that's why I write my books. My thing was that I wanted to change the world,
Mhm.
one book at a time.
Okay. And um, okay. And by the way, how many books have you written?
I have written now 5. I just
Oh,
released
very good.
my newest book called Perfectly Perfect, and it teaches children about body image and empowerment. I'm always about trying to encourage people.
Oh, very good. Very good. Yeah. And and so. That makes a lot of sense. Makes a lot of sense. And you're very much in line with that. Um, when you get into office, now government has some processes for informing the public and so forth. How would you expound upon what you're doing once you're actually a senator?
One of the things that I have found when I am out talking to constituents
Hmm.
is that they are so far removed from like middle school and high school, they have forgotten how government works. And I have found myself explaining to them how government works. And I think it's about education and re-education and transparency. And I would like to have my website
Hmm.
to be more educational and transparent, say, this is what we did and this is what I'm doing, and explain it and saying, this is how this is going to affect you. So they can have links and they can click on what's going on in in Sacramento. And this is how it's going to affect the district. And that way they can kind of follow along. Because there are state websites where they can click on the legislation, and they can do
Hmm.
that too. But a lot of times they don't really understand the legalese.
Hmm.
But if it can be interpreted and broken down into common everyday language so that people can really follow along, I figured I call it BID, break it down. They can bid on it, right? And
Hmm.
really follow along and say, okay, I really get it now. And I think that everyday people deserve to know what their vote has done and how their vote is affecting them. Because when you go to the doctor, we don't say, okay, you have, this scientific term. No, we actually break it down to make sure you understand it. And I think when we go to Sacramento, we don't need to talk to our constituents in Sacramento talk. We need to break it down. They need to understand how this law is going to affect their everyday life.
Okay, that makes sense. Makes a lot of sense. Very good. Very good. Now, in addition to being an author, of course, you are a doctor. Okay. And so you have insights on healthcare and the healthcare situation that most candidates won't come to office having. How does being a physician affect your perspective on the healthcare situation?
Absolutely. I always tell the constituents that I've been on both sides of the speculum as an OBGYN, or I say I'm
Okay.
at your cervix, and that
And
just tickles them.
you'll be here all week, won't you? Okay.
Yeah, I have lots of puns. And
Uh-huh.
so, and it just cracks them up. But I think the important thing is when we talk about affordability and access,
Mhm.
I understand the ins and the outs because I've been in private practice, I've been in academic medicine, and I've been in military medicine because I've practiced in all types of different spectrums. And what I bring to the table is something that the other candidates don't. And when I get the opportunity to go to Sacramento, I can help legislate and help improve the system. And I actually serve on the board for an organization called Momentum Park. And what we do across the nation, United States, is
Mhm.
help incorporate telemedicine and bring it to
Okay. Yeah.
moms and babies to help improve their pregnancy experience. And I think that that's important because when you look at the healthcare access in my district, as well as in California and really across the United States, it is worsening. And my district is a healthcare desert, which means we have poor access to healthcare. And I was actually talking to a provider who saw a patient who had insurance but did not get prenatal care throughout her pregnancy. That is
Mhm.
incredibly dangerous. And if you look at the maternal morbidity rates in the United States, especially in my district, they are bad if compared to other industrialized nations. And it's because we don't have access to care. So how do we improve it? Well, we need to make it more accessible, number one, and we need to
Mhm.
make it more affordable. And it's not accessible because we don't have we don't have enough clinics and we don't have enough access. So I want to improve telemedicine. I want to improve mobile clinics. So these are the things that I want to implement when I get to Sacramento. And I want to make sure that we have the funding for providers. I want to make sure that we increase hospitals and increase access. That's long term, but in the immediate term, in the interim, we can make telemedicine accessible and we can improve mobile clinics and we can provide more doulas, more nurse practitioners, and we need to decrease burnout, and we need to improve the nurse-patient ratio, the physician-patient ratio, all those things that we are things that we need to work on.
Okay. Very good. Very good. And the uh and now, I'm here in Dallas, Texas, and you're there in Los Angeles and California. And the healthcare situations are somewhat different between the two. How is the insurance situation with regards to healthcare in California?
Well, the reality is it's geographically different, but the situation when it comes to medical care, it's
Hmm.
the same across the United States. It's dire. When you try to make an appointment with your provider, you probably still can't get in with your primary care provider. You're probably told that you still have to wait. And it's about access and affordability. And there are different systems that can get you in, whether you have Kaiser or a different insurance, if
Hmm.
you have Medicare, Medi-Cal. But we also know that what happened in DC, they've made so many cuts that there are a lot of people who lost their insurance. Now, we know that our governor has tried to fill in the gap, but we still know that some patients are still suffering and lacking the insurance that they need. And we are
Yeah, and
trying.
you're going right where I was hoping you'd go with that. Is there something the state can do to offset the national issue of the impact that, what the federal government is doing with regards to healthcare, the ACA Act, and things like this? Um, so you're going right where I was hoping you would. Let me back off my
Absolutely.
interruption. Keep going.
No, yeah,
Okay.
yes, absolutely, absolutely. And so that's what that's what our governor is currently doing. And there's a ballot initiative that they're trying to put on for the fall to help cover the interim funding to make sure that people can get the care that they need. And
And
so
as
we'll have to wait and see what happens in the fall.
okay, but as a senator, you would be able to also help support these things.
Absolutely.
Yeah, and fantastic, fantastic. And um, how does this? So, how does this affect the economy? In California, in your district, what is the situation with the economy there? And becoming a senator, um, what do you think you can do to help the access and affordability to food and you know rent and living wages and things like this?
Absolutely. The people in my district, as well as the state of California, are hurting right now. When
Hmm.
they go to the pump, they are feeling it right now, and they need relief right now. They don't need it in 2 to 3 years. They need relief now because the gas prices are going up and they are expected to continue to rise. So, in the interim, when I get elected, God willing, I will
Hmm.
push for a relief of the gas tax because we don't need relief later. We need relief now. People fill up their gas pumps on a regular basis because they have to get from point A to point B, whether it's to pick up their children, whether it's to go to a job, whether it's to visit family. So they need relief now. So what I would do is try to push for a relief of the gas tax because that will give them immediate relief. I will also push for child care credits because childcare can cost as much as rent here in the state of California, and people have to take care of their children to even go to work. So these are things that can help them now, today, because those are immediate things. In the long term, I will push for maybe rent. rent pauses and rent credits and even tax breaks for their homes because we have to look for long-term relief as well. We can't just say, okay, we want to put a band-aid on it. We have to figure out what we can do. I also want to work with builders because the average age for first-time home buyers is like 40 to 50 years old. What
Wow.
about, I know, what about the people who are coming out of college who get their first job and then they have to rent until they get to like 40 or 50? I think out here in California, we are building these huge multi-million dollar homes that have like 4 or 5 bedrooms, 3 bathrooms. They're not starter homes. We're not building starter homes. And what about our seasoned people whose kids have moved out and they want to downsize? So we're not building those homes for like the 20 something year olds or seasoned people who want to downsize. So we really need to work with our builders, incentivize something for them to build homes for those interim people. We really need to be practical and we need to reassess what we're doing and who we're doing it for.
Yeah, excellent. And one of the things that, and I don't know if California has this, but I know other parts of the country do, is they have special laws and rules around ADUs, affordable dwelling units. Like if you have a house and you build an apartment over your garage, then there's a tax break for that or things like that. Um, so those kind of things, if California doesn't already have them or your district doesn't already have them, might be a way to spearhead that starter type homes because ADUs, by their very definition, are starter type homes, affordable
Mhm.
dwelling units. So putting together an ADU bill, could help spear that. So uh,
Absolutely.
yeah, so very good. Um, so home ownership is a big thing there, and home ownership goes hand in hand with social welfare. If you can't afford a home and you later can't afford rent, and you start to get pushed out of society into homelessness, these kinds of things. Um, it's all tied together. From a social welfare perspective, what's the most important thing to you on that front?
Well, from a social welfare perspective, there's a lot of things,
Okay.
but I
What are
there's
the
like
10 most important things then?
Well,
There we go.
I'll narrow it down to my number one, and then my top two. Social welfare. As a veteran, I look at veteran suicide. Well, top two, veteran suicide and homelessness.
Yeah.
We have a lot of veteran suicide and homelessness, and I think that it's something that needs to be addressed because you have to focus on their accessibility, their transition from active duty back into society, and making sure that they get the resources that they need. As a veteran, I think that they often get overlooked, and we often get overlooked. We do have March Air Force Base out here. They do provide some housing, transitional housing, but it's not enough for every single veteran. And then there is the Loma Linda facility, but you have to have a vehicle, and every veteran doesn't have a vehicle. And we have to look at how are we supporting our veterans in a more accessible and meaningful way. And you have veterans who come out and they have PTSD, and you look at the fact that we are at war now. So we are creating another generation of veterans who are going to have PTSD. And people don't talk about survivor's guilt. So, yes, you
Mhm.
have veterans who are losing their lives now, but you have veterans who are going to survive this war and they're going to come out with survivor's guilt. Survivor's guilt is a form of PTSD, and people cannot dismiss that. And as a physician, I understand what is happening overseas and what's going to come back from overseas. And we have to be ready and willing and prepared to make sure we can address all of the issues. We need to make sure we have housing for them, we have the mental health support for them, and we have the clinics available for them. And right now, we don't have the resources available for the ones that are here. So we are not ready for the onslaught that's going to come back.
Ouch, ouch. Yeah. And and that was just your number one. Okay. So yeah, that's very emphatic. And good point. I mean, and you know, they just sent 2,500 boots in the direction of the Middle East, you know. So you're spot on. If the current situation escalates, yeah, it'll it'll need the follow-on support that you're talking about. So
Mhm,
so healthcare, economy, social welfare, these are all big, big, big issues that your constituencies are facing and so forth, and then dealing with on a day-to-day basis. So I'm very, very thankful that you're in the fight, that you're working to get in a position where you can bring some of your tremendous experience to the table and do
mhm.
something about these issues. Um, Anything else you'd like to say about that?
Well, I just think that when it comes to making sure that our veterans are taken care of, we cannot turn a blind eye to the needs of our veterans. And as a veteran, I want to make sure that we stand up and we support them. And when you see a veteran with a hat on, please make sure you thank them for their service.
Absolutely. Absolutely. And thank you, Dr. Tate. Yes. Uh,
Thank you. Thank
As a
you.
veteran, yes, thank you. So, as we wrap up here today, folks, if you'd like to support Dr. Tiffanie Tate, visit her website, votedrtate.com, and just DR, VOTEDRTATE.com. And so, thank you for your time here, Tiffany. I really, really appreciate you taking the time out of your busy schedule with us here today. And it's been a pleasure.
Thank you for having me. I love it. And I just want to make sure that people understand that your vote matters. Every vote matters. And if you ever have any problems voting when you go to the polls, vote early, take a friend. And if you have any issues, make sure you ask for a provisional ballot.
Excellent. Yes. And you will show up on that ballot as Tiffany Tate, correct?
Yes.
Correct. Good. Okay. To all of you watching this video, please click the like and subscribe buttons below so we can bring you more oath certified candidates like today's guest, author and Dr. Tiffany Tate. Thank you so much.